Hello, Dr. Christopher Gay again, Pain Management Foundation Health Partners. And today, we're going to continue our series and talk more in depth about epidural steroid injections. We mentioned that in a previous video about sciatica, and in this one, I want to give you more details. Approximately 9 million epidural steroid injections are performed each year in the United States to reduce pain and inflammation, primarily in the back and down the legs, but also in the neck and down the arms. And so we want to talk about how does it do that? What is the mechanism by which it can reduce this pain? We don't exactly inject a painkiller, which a lot of people think. We're actually injecting a combination of usually a local anesthetic and a steroid directly into the epidural space. Now, epidural is a term people are familiar with primarily from people having babies. They got an epidural. But really the epidural space is a location in the body that runs from the base of the skull pretty much down to your tailbone. In that space, you can inject medications that can influence the nerves and affect the nerves around them. So when you have a baby, a lot of local anesthetic to make it not painful. In this particular case, when those nerves are upset and inflamed, we inject a steroid, which is a very strong anti-inflammatory to reduce that inflammation and secondarily reduce the pain. The pain will usually stay away for various amount of times for people. What I say is that it gets it to the point where your body can handle it and your body may handle it for different amounts of time. The steroid itself is usually gone after about 6 weeks. So what conditions can we treat with epidural steroid injections? Herniated discs, spinal stenosis, sciatica, and several others, even pain that persists after shingles. So if you're going to have one of these procedures, you'd probably want to know what to expect. So it's usually done under local anesthesia. It can be done with sedation if you are very anxious about the procedure. It's not a very long procedure. It only takes about 5 to 10 minutes. But the pain relief, that will typically begin within about 3 to 5 days of the injection, and that'll peak at about a week after that initial onset of relief. So at about 2 weeks, that's about as good as it'll get. And we'll see if we need to repeat that or what the case may be. Various insurance companies have different guidelines on how many you can have per year. We have other options. If you cannot have more injections, there are many other things we can talk about and consider, such as the mild procedure, which we'll talk about in another video later. So risks and benefits of the epidural steroid injections. This is a generally safe procedure, but anytime you put something in the body that did not begin there, there's a risk of an allergic reaction. Anytime you break the skin with a needle, scalpels with surgery, or anything of that nature, there's a risk of infection. There's also a risk of bleeding deep inside the body for people that are on blood thinners. So we want to limit all those risks, and we use guidance, X-ray guidance called fluoroscopy, to limit damage to surrounding structures such as your nerves. In general, these procedures can help reduce your pain, provide relief, improve your function, and help you get back to enjoying life. Give us a call today. We'd be happy to talk more about it with you.